Hello and welcome, Professor Nikolai Petrovsky, once again. Let us start by laying out two waves of communication technology that I feel have pushed tremendous societal change. It has brought um, massive individual freedoms, happiness, and commerce. Both waves of this communication technology are almost 100 years apart. So, if we look at the first half of the 20th century, the motorization actually added to or transformed the linkages and the way we communicate physically. But it was not until, say, mid 1960s that the public health impact was being felt and registered in what we now know as almost a new subdiscipline of injury and trauma epidemiology. Roadside crashes and automobile accidents became an externality. From that also came out uh, the protocols that govern the emergency departments of hospitals around the world today, with automobile crashes still adding to uh, some of the major or the major share of accidents and the type of patient that the doctors and physicians get to see. I was just comparing it with what we've had in last 20-25 years. Fortunately, you and I come from that generation that has seen the manual work or a pre-internet age to the one that we have now, where everything is increasingly digitalized. So, do we have some lessons from that first, what I call the first wave of communication technology that transformed societies, compared to what we have now, what I call the second wave of communication technology, with devices in our pocket, interconnected, talking to each other, signaling, beeping, notifying us all the time, and actually competing for our attention. So, is this a comparison, or am I just thinking apples and oranges?
No, look, I think it's a very good analogy. Any technology that transforms society comes with a potential for that technology to be used to improve health. Whether it's having ambulances that get to people faster with the motorised age, or having ability to call an ambulance from anywhere using your mobile phone in the digital age. So all technologies have health impacts. Many can be used for improving public health, but of course, like all technologies, they can come with potential public health harms. And you mentioned cars were a great advance, but, before cars we didn't have car injuries. We had people thrown off horses, but we certainly didn't have, the severe trauma that from two cars crashing. So with information technology, again, there can be great benefits for public health. We're seeing potentially enormous damages. We've seen suicide rates go up. We've seen mental health issues skyrocket in younger people. A lot of them attribute that to their experiences with social media and how they're not trained really to handle social media. And so I think, realistically, whenever we have a technology revolution, public health professionals should be looking, how can we use this to our benefit to improve health, but at the same time should be looking very carefully, saying what are the negative health consequences that may arise from this technology, and then how do we manage that? Like, how do we limit the negative public health implications of this technology? You can never eradicate it. It's like we can't eradicate car crashes. We can certainly reduce them. And I don't think we're doing enough looking at the public health harms of social media and the information age, in advance of the problems. We're letting the problems happen, and then we're confronted with how do how do we tackle them? We should be proactively predicting the problems and implementing systems in advance, not just rolling out the technology with, not in any way caring about the harms it will cause and then saying we'll fix that later. I mean, it's having impact, negative impact now, and there are people who are not alive today because of social media. We know that. That's a fact. We can't bring them back. So there's an urgency to tackling the negative public health consequences of, as you say, the technology revolution, whether it's social media, artificial intelligence, or just the increased connectivity. There are negative consequences to that.
So, could the history be repeating itself, that it took a while before the injury mortality and morbidity was high enough to prompt somebody to maybe, for example, in United States, which was leading the first wave of the communication technology by motorization of its society.
I'm not sure the US were a leader. They were the last country in the world pretty well to introduce compulsory seat belts. We had them, I think they were compulsory in Australia 20 or 30 years before the United States. So the United States in many of these ways is the slowest country in the world. It has the best technology, but arguably it has some of the worst public health. And that's just a fact. If you look at poverty and the socioeconomic implications of poverty on, childhood mortality, the US has some of the highest rates in the world, despite having some of the best hospitals and the best technology in the world. So we shouldn't assume the US is a leader. In some cases, in public health, they are right at the other end. They're the laggard that takes 20 years to catch up to what's happening in the rest of the world. I think same for cigarette advertising, alcohol advertising. The US typically can be 20 years behind in terms of implementing, clear public health strategies that have been proven to work, in multiple countries, and it will still take the US 20 years to get around to actually implementing them. I mean, that's the other side of the coin to the fact that they also developed some of the world's leading drugs and medical technologies. But let's not assume they're the leaders in everything, because, as I say, seatbelts, I think, is the absolutely classic example. Very simple, cheap technology. The rest of the world implemented it, proved it dramatically reduced road deaths, and it took 20 years for somehow, and I think still in some places in the US, it probably still isn't mandatory to use seatbelts. I don't know, but I do know it's taken an awfully long time.
So, regarding the two disciplines of epidemiology, the mental health part and the ergonomic injuries, leading up to this discussion, I tried to search with whatever little time I had. My perception is that these are not measured enough, although internet has been here now for 25 to 30 years, but I just felt that the kind of evidence that could go into some of the conditions that we know, for example, texting thumb because of overuse of devices, and texting neck because of a certain angle that your head makes with the neck, with the body, while viewing the digital devices. I just personally, whatever time I had, felt that there is not much of the literature, the peer-reviewed evidence out there yet.
The problem is when you have a technology that everyone embraces overnight, you can't do placebo-controlled trials, which is the gold standard of doing research. To have a group who don't use the technology and prove that the technology is causing the problem or causing the harm. And also you have enormous financial imperatives, because, when a new technology is rolled out, behind it is a whole new industry that's generating, in the case of the internet, trillions of dollars. from that, that's creating hundreds of billions of dollars are going to the government in taxes and various revenues, which is creating employment. So, that from a public health standpoint, to step in when everyone else can see this just massive opportunity and say, hold on, I want to slow this down or I want to restrict this. It's like standing in front of the ocean and trying to stop the tide coming in. And I think that's what public health people struggle with new technologies is there's just such enormous pressure behind it, and what can one public health expert do in the face of a $1 trillion industry that's doubling in size every year or every 2 years? I mean, it's impossible to stand in the way of that. I mean, you'll just get trampled, and I think that's why public health people often are quite sort of sometimes bitter and twisted, because they can see the problem, but they can't get politicians to listen, they can't get business to listen, because everyone's making too much money from the new technology. And it's only when things settle down a bit that maybe the public health people can show what the issues are and try to slowly correct some of the damage. But unfortunately by then a lot of the damage has been done. But how do you do it differently? I don't know, because you can't stop new industries. I mean, you can't stand in the way of that. The world is very much about progress, and particularly when you have a new industry like the internet that people can just see is going to transform the world. No one will tolerate someone who's negative standing and saying, wait, this needs to be carefully rolled out, not just let go uncontrolled. So I think it's human nature. I don't, to be frank, I don't think we can change that. But we just have to be more vigilant and work harder. Maybe not, we need to warn people what's going to happen, but then expect them to ignore it, but then remind them when they do start listening, here are the problems, let's, now we've already got a plan as to what we need to do. And, we're seeing that in Australia. We've just legislated to restrict social media access for children under 16 because of the damage it's doing. So it's now legislation. Now, maybe in the US it will happen in 20 years, but it's already started in countries that are trying to get ahead of this, or at least get it under some form of control, because we've had too many suicides apart from anything else precipitated by social media.